Welcome to Soul Sparks. I'm your host, Pragya Malviya, and today we are diving into something most of us don't think about until the letters on a page start blurring. Because to be very honest, it was that for me. You know, you're getting the idea what I'm talking about. It's our vision. But what if losing sight isn't just about the eyes, but also a signal from the whole body and even the spirit sometimes? So, joining us is Dr. Andy Rosenfarb, who is a trailblazer in holistic eye health, who's helped people across 50 plus countries, not just to see better, but also live better. And that is so inspiring. Through acupuncture, herbal medicine, and cutting edge treatments, he bridges ancient wisdom with modern science to show us how vision care can be as much about our lifestyle, mindset, and well being as it is about our eyes. So take a seat, take a notebook. If you have something to write about, note it down, or even just listen to it because this is going to be terrific. And that too in a good way. So, first of all, thank you, Dr. Andy, for joining us today. It's a pleasure to host you.
So great to be here, Pragya. Thank you so much for having me. I'm very much looking forward to this conversation.
That is so great. So, okay, I would love to start with this. The thing that I also mentioned when I was talking about you, that, most people think of eye care as glasses. It's like their vision is getting a bit blurred. They wear glasses, and that is what all they have the idea of eye care. Or if they're using contact lens. So when you talk about holistic eye health, what exactly do you mean by that? Because I know your spectrum of it, your understanding of it is way broader than this. And I really want to know how is it different from the usual approach that commoners have?
Oh, that's such a great question. So, what you're asking is really a distinction between conventional ophthalmology or the conventional medical model of eye care, eye health, as it relates to or it differs from holistic eye health or holistic ophthalmology. And the answer lies in the words itself. So, most eye doctors, as you indicated, people think of eye health, go to the eye doctors. Maybe you need contact lenses when you're younger, maybe a set of glasses, maybe sometimes you get some eye strain or tension headaches or something like that. Later in life, maybe you'll, have cataract surgery, or maybe you'll deal with dry eyes, or maybe your vision will get a little bit blurry. And maybe you, whether it's in your family or not, you might be dealing with some age-related eye diseases or other eye diseases like glaucoma, macular degeneration, even eye strokes, or if you have diabetes, diabetic retinopathy. So there are all these conditions, all these ophthalmic conditions, these refractive issues that affect how we see. There are more deeper neurovascular issues that affect the retina or the optic nerve. And the idea here is that conventional ophthalmology really focuses on just the eyes and often forget that there's actually a body attached to the eyes that have underlying causes that can drive some of these conditions. So holistic ophthalmology, or functional holistic ophthalmology, is a way of, or approach rather, of looking at vision, eye health, as it relates to the whole body, all the systems of the body, everything, the respiratory system, the circulatory system, the nervous system, the lymphatic system, cardiovascular system. All the different systems of the body will in fact affect the vision. So we need to take a broader view, step back, and audit a person's body and health in its entirety if somebody's dealing with some acute or chronic eye issues. So what I mean by that is we want to find out what's causing it. We don't want to just give somebody moisturizing eye drops, or they have headaches. We're going to give them some glasses, which may help because they're having eye strain. But what's going on deeper? Are there muscle tension issues? Are they spending too much time on screens? Are they reading too much? Are their eye health practices or eye hygiene practices is not great? So again, what we're really looking here is the distinction and difference between isolating the eyes as its own sensory organ versus looking systemically and holistically at the body and what internal factors, we call genetics, or external epigenetic factors can impact a person's eye health and overall health.
Thank you for giving us that distinction. And yes, they're totally different things. If not totally different, but approaches, they're really different. And I believe the effects are totally different too. Also, as you mentioned, that there is a lot of there are a lot of things basically that go on which lead to certain situations with our eye. So why do you think that we rarely connect blurry vision or eye problems with stress, diet, or emotional health, or other things that go on inside our body? So why do we ignore that? Is it traditionally just given to us or feeded inside us, or is it something that is a whole different perspective?
Wow, that's another great question. In terms of understanding how and why eye conditions come about, one needs to understand the systemic, holistic nature of health and how a body functions. So, yes, if somebody has a refractive issue where they need a pair of glasses to either read or see distance, a child's in school, maybe they're seeing blurry vision, yeah, of course, we want to use the appropriate tools, get their eyes examined, get their prescription checked, decide if we're going to use glasses or contact lenses, or maybe even use something like LASIK surgery to help correct. But when we get deeper chronic or acute eye pathologies that really can affect a person's ability to see clearly and function, there are two different type of factors, if we kind of want to break it down, that can really drive these. And again, I alluded to them earlier. We have genetic factors. A lot of these conditions, again, glaucoma, macular degeneration, conditions like retinitis pigmentosa and Usher syndrome, which are genetic, Stargardt's macular dystrophy, eye strokes, glaucoma. These are all systemic and neurovascular in nature. So they're pretty deep and pretty systemic. So usually what happens, again, there can be a genetic tendency by which other family members, maybe parents, maybe grandparents, have had these disease processes. So it's part of the gene pool in your genetics. So that is going to increase some risks. But what happens with that too is a lot of conventional medicine will just stop there. They'll say, oh, you have retinitis pigmentosa, or you have Usher syndrome, or Stargardt's. That's a genetic condition. And then just leave it there. Okay, well, there's no treatment, maybe some supplements, maybe a couple things here and there, but there's no real treatment for it. But it's genetic. In my opinion, that's somewhat of a lazy diagnosis. It is true, there is genetics, but that doesn't really help us to understand, again, holistically or systemically or functionally what's going on with the body. Sure, we can take pictures of the back of the eye. We can do assessments to get an idea of functionally what's going on, functional visual deficits. And we can do imaging so we can see if there are structural breakdowns. So that's just going to give us an overview of what's going on. But again, it doesn't help us understand what's going on, what the cause for these conditions are, which again, if we look at genetics, that's a disposition. Now, you can have a genetic gene in the family, but you have 3 children with parents with, say, glaucoma, retinitis pigmentosa, one of these conditions. Why will one get it and the other 2 won't? Right? The genetic disposition is still there. But why is one person in the family going to express these? And why would some people express these diseases who have no family history? And that goes back to what you had indicated earlier, is this idea of epigenetics, these internal stress factors and environmental factors that can have a major significant impact on our health and well-being and can really honestly affect any area of the body. But for purposes of this conversation, it's going to affect your vision. So again, things like over time, lifestyle habits, not eating healthy, eating too much junk food, right? Eating too fast, not eating processed, refined foods, not enough whole foods, vitamin-rich foods that have the vital nutrients, not sleeping. Our body doesn't It doesn't repair and regenerate. So we're not sleeping. We're not hydrated. We don't drink enough water. We don't exercise. We have a sedentary lifestyle. You spend hours and hours and hours in front of screens, in front of our laptops, our desktops, our cell phones without taking breaks, and just redline our eyes. This new exposure to blue light that comes off screens, that our biology has just not caught up yet to the technology of this constant blue light radiation that most of us experience while we're sitting in front of screens so much. Add that to high stress, emotional stress, not sleeping, poor diet, not exercising, other comorbidities, other health issues. It's a recipe for disaster for some, not for everybody. So again, it's these genetic tendencies that can play a role in this, which can be exacerbated by epigenetic tendencies, or if there's no genetic tendencies, you can have these stress factors show up in such a way that it's going to attack different areas of your body. In this case, it's going after your vision because your eyes have just been so beat up from overuse and not caring for your body that we often miss the early signals. Our eyes get tired. Maybe we get a little headache. And our neck gets strained. We ignore these. And by ignoring these, our body's going to give a louder signal until we do respond.
Thank you for sharing those insights with us, Doctor. And yes, I totally resonate with you because, it's high time that we really understand that there is a lot to do with our daily habits and our stress, our diet, and our routine work, our exercise, even our breathing patterns sometimes. So thank you for sharing that with us. And I hope our listeners, they take these insights and implement it because they're actually something that everybody says, but a few understand what actually it means and where actually it is applying. So thank you for that.
You're welcome. Well said.
Also, you've worked with patients from so many parts of the world, and as you mentioned that you've worked with 50 plus countries and you've helped people from 50 plus countries. So I would love to know what is the most common story that people come to you with when they feel their eyesight slipping, or what is that one area of the continent or this world that you feel is having certain other problems, but the others are having certain others. Yeah, so what is it?
It's a great question. So geographically, there are statistically some races like African Americans are basically tend more towards things like glaucoma. Macular degeneration is a little bit more common in Anglo-Saxon people with blue eyes typically. So there are some demographics that certainly show different parts of the world, different races, different cultures, even different age groups, different genders who are going to have susceptibility to different eye conditions. So we do see patients from all over, and it's not as local as we used to think, right? I'm sure about 500 years ago, or maybe even 200 years ago, when travel wasn't as easy as it is now, it was a lot more segregated. So we'll have like different communities or different countries and different cultures. But because the travel has become so wide and interracial marriages and partnerships and stuff like that, I think that I don't want to use the word diluted, but it's not as isolated as it may have once been. We do see there's a couple of things that we've seen that I'll speak to in a few minutes that have changed over the last 30 years that I've been working with patients dealing with eye issues, and I'll be happy to talk about those. And there are environmental factors. There are new factors like we just talked about. Like one of the factors is computers, right? Screens, smartphones, laptops, we've had them for a while, right? Since like the late 70s, early 80s, we've had desktops, old computers, but in the last 10 to 12 years, smartphones came out. And out of nowhere, everybody was walking around with a handheld, either a tablet, cell phone most of the time. So again, this new stress, this radiation stress of blue light is something new that we're not used to. So what's happening is we're getting this blue light radiation that comes off screens, and most people aren't protecting their eyes with blue light glasses or taking carotenoid-rich foods like vitamin A, retinol palmitate, leafy green vegetables, carrots, pumpkin, squash, that will help protect the retina and specifically from blue light and ultraviolet radiation. So that's a major factor and a major shift. And one outcome that I've seen as a result of screen use, in addition to dry eyes and, as you indicated earlier, breathing, respiration rate, posture is all affected because everybody's like hanging over their desktops, their laptops, their computers in poor posture, and their phones and tablets. So there are postural, there's breathing. We don't blink as much when we're on screens. So we get dry eyes, the radiation, again, that comes off the electromagnetic frequencies. We're also seeing macular degeneration at a very early rate now. Well, now, when I first started practicing about 30 years ago, everybody I saw with macular degeneration was generally in their 70s. And we have patients coming in as early as in their late 40s and 50s now with signs of macular degeneration. And one of the reasons that is because of the overuse of screens and the blue light radiation that particularly stresses out the cone cells in the macula. So they basically get beat up from all the lights and the flickering. So again, what you can do is reduce your screen time, take breaks, use blue light glasses, take carotenoid antioxidants, use screen filters, night mode, and just try to take more breaks, more digital breaks throughout the day. And I know you're working. I know there are students out there. I have 3 boys in school, and they have a lot of work to do. So it's not easy, but it's necessary, and it needs to be scheduled. Other things we've noticed are the rise of autoimmune conditions, autoimmune ocular conditions, like the rise of autoimmune optic nerve issues, the rise of autoimmune retinal issues like retinitis pigmentosa, Usher syndrome, Stargardt's macular dystrophy, birdshot choroidopathies, things like that, uveitis. Since COVID, we've seen an explosion of eye strokes, optic nerve strokes called NAION, and retinal strokes. And more recently, especially in the United States, and I'm not sure, I just don't know off the top of my head if it's really made its way to Asia or Europe, but there are these weight loss injections like Ozempic that people are using widely now. A lot of people are using them, and they get great results. They work really fast and help people with weight loss, but there's also a tremendous risk of increasing the probability and the likelihood of eye strokes, as well as individuals with diabetic retinopathy. These drugs can really accelerate progressive vision loss associated with diabetic retinopathy. So there are a lot of factors that have gone on, even from COVID, the COVID virus and vaccine that people had. Eye strokes have been off the charts since then. So this pestilence factors is another thing that comes into play. Plus all the processed food, medications that people are taking. Dry eyes, very, very high now because a lot of people are on cholesterol-lowering medications, which dries out the fats of the body. They're on diuretics for high blood pressure. That's dehydrating them. That's giving them dry eyes. So there's a whole host of factors that can really accelerate and be causative, not just regionally, but around the world. And that really affects everybody.
I totally agree to it. And again, thank you so much for sharing the geographical part of it. Also, uh, there is a high chance that, a lot of people, they face same issues in future because the main prerequisite of this all is the screen timing, right? All use and no precautions that we take is something concerning. I may not be wrong if I say that, you step out in sun without sunscreen and you'll anyways get tanned. So
Yeah.
it's just like this.
Yeah. Yeah. Little's fine, but 5 hours, when I do my work too, I have to set my alarm to take breaks because I'm sure maybe you've had this experience too, or some of your listeners. You dive into a project or emails, or you're doing research, or you're working on something, whether it's work, research, maybe you're making travel plans, and the next thing you know, 2 to 3 hours has gone by, and you're like, oh, you feel it in your eyes, maybe you get a headache, you're tired. So that's what I'm talking about. Those we just log in, our brains dial into our screens and we get sit there. Even when we're bored, we're in the 21st century, everybody's doom scrolling just for entertainment now. So screens are it. That's our main source of entertainment now for most people. So we need to be just responsible. And I'm not suggesting at all that people, screens are bad, you got to get rid of them. It's just there needs to be more of around digital eye health and the consequences of not taking care of your eyes.
So true, so true. Also, there is this question that is coming in my mind as
Mm,
we've talked about the major issues and everything. You use acupuncture and herbs alongside therapies,
mm.
you know, like hyperbaric oxygen and photobiomodulation and all of these. These worlds of tradition and technology, they're actually very different. So, how do you use both of them in one treatment plan, and how do you make this amalgamation?
Such a great question. So it's been my experience over the last 30 years that you have the conventional biomedical model of ophthalmology, and then we have traditional models, traditional Chinese medicine, Ayurvedic medicine, Tibetan medicine, herbal medicine, a lot of these thousands of years old that have been helping patients suffering with eye conditions. Then more recently, there's functional medicine, there's naturopathic medicine that's similar. And what's similar about it is because we're not really addressing symptoms. Of course, patients are coming in for their eyes, other things are going on, vision, blurry vision, dry eyes, vision loss, whatever. Of course, they're coming in for that. But we need to look at patterns, the underlying factors that are driving these. All right. So, yes, we want to help improve the symptoms, but we can't make meaningful progress and lasting progress unless we understand the factors that are driving this. So, when you take the conventional diagnostic methods, emergency treatments, injections for bleeding, repairing of retinal detachments, cataract surgery, they're all very, very effective. When we marry that to the traditional medicines and the holistic models of traditional Chinese medicine, of naturopathy, of functional medicine, ultimately, the best value of that is it gets the best clinical results for patients. And that's what matters most. It's not one is better than the other. The cultures and countries that have embraced the integrative model without question gets the best results. So when you take somebody with glaucoma and you need to lower their eye pressure, you can lower it with drops, sometimes a surgical procedure called a trabeculectomy. And then conventional medicine is only going to manage the eye pressure. That's all they do for glaucoma, through drugs and through surgery, while ignoring the optic nerve. So we tell patients, great, let your eye doctor help do whatever with drugs and surgery to help manage that eye pressure. We're going to focus on your optic nerve. Patients with macular degeneration, they have wet type macular degeneration with bleeding. They're going to have to go get injections periodically to help manage the bleeding, which is fine. But the injections don't do anything to help the eye heal. They don't help deal with the drusen, which is the cholesterol buildup under the retina. And they don't help the health and function. They don't help them to see better. Actually, sometimes the injections can accelerate and they can cause some problems for people. Not always, but in some cases. So again, the medication's there. And then we have some conditions where there's no conventional treatment. Dry macular degeneration, geographic atrophy, retinitis pigmentosa, Usher syndrome, genetic night blindness, idiopathic optic nerve atrophy, normal tension glaucoma. There isn't a treatment. There's no drugs and no surgeries available for these conditions. So in those cases, we are the only alternative. There is no alternative. This is all that's available to them. So while some cases will use an integrative approach, there are some cases that there's no treatment, but we can still use conventional medicine to monitor the progress, where the conventional eye doctors are seeing patients maybe once or twice a year to monitor their progress and see how rapidly their vision is declining. We're using it to monitor their improvement and their stability and recovery and preservation of vision. So that's where East and West, conventional and traditional medicine meets and can work together again to produce the best clinical outcomes, short-term and long-term for patients.
How wonderfully explained and I totally get it, that it is nothing that, if you're following one approach, you can't follow the other one. It has to be the amalgamation and the integration, the word that you used. And yeah, totally, totally right. Love that, love that. Many people, they believe that, eyesight loss, it is just a part of getting older, because I have a grandma, and every time she has some issue with her vision, all she says is that, oh, now I'm getting older, so this is why my eyesight is like this, and it will always be like this. So, from your experience, is that really true? Because yes, does matter sometimes. So, what is it with your perspective?
Another fantastic question. So, yes, age is significant and does play a role. However, the conversation that my eyes are getting worse because I'm older is debunked, because that would mean when anybody hit age 75 or 80 or whatever, everybody would lose vision. And we know that's not the case. So there are inherent weaknesses. Some people may have weak eyes, circulatory problems that may show up later in life because that was already a predisposed weak area. Also, we know as we age, things happen. We know circulation decreases. We know blood flow isn't as great to the eyes. We know we tend towards inflammation a little bit more. Our elimination isn't as good, meaning breaking down waste products and getting rid of them. Our ability to produce energy, cellular energy on a metabolic level called ATP, which in Chinese medicine we call qi or qi. This is life force energy. So as we age, the body isn't as efficient as it used to be in terms of producing energy for functionality, which is why we feel a little bit tired as we get older as well, because the mitochondria that produce energy inside the cells aren't as active, as functional as they once were. So again, when we ask that question of aging, my eyes are getting worse for aging, we need to be a little bit more sophisticated and dive into that conversation, which is a very worthwhile conversation. What is aging? What does it mean generally and specifically to each individual person? Like if you have eye problems and your vision's declining, but the rest of your body's pretty healthy, then your body may be 60, 65, your eyes may be 85, because they've aged faster than the rest of your body. So there's relative aging, right? If you have heart disease at a young age, your body may be, again, 50, but your heart may be 70, right? You have some of these brain developmental or brain degenerative processes like Alzheimer's or Parkinson's or ALS or Huntington's. The brain and nervous system ages faster than other parts of the body. So we have to consider that what is age generally? Dehydration, oxidative stress, the shortening of telomeres. Is it mitochondrial weakening and dysfunction? Is it accumulation of metabolic waste in the body? So there's all these factors. It's like pieces of a puzzle. So again, we have our general factors that we know that happen as we age, but then we have to, on top of that, look at each individual case and how and why are certain areas of different people's physiology breaking down faster, and why. So why are your eyes aging faster than the rest of your body? Why does your brain age faster in a specific case? Does that make sense?
It does, it does. It clearly, clearly does. And yes, I again get your point, and I agree to it on a very large basis. Also, if I may ask, what are some simple habits that, as you've been mentioning about diet, screen time, and everything? So, very simple habits that you wish everyone started earlier. And because at this age, even teenagers, they have access to screen for long, long time.
Yeah.
So, what is that one habit that can be inculcated within them, and as adults also, what people should inculcate in themselves?
Making a priority to just learn about eye health. No, it's not talked about. Your teachers aren't going to talk about it. Your doctors usually aren't going to talk about it until it's a problem. Do some research. Follow me. Follow my Facebook groups. Yeah, and it's your micros, it's your sleep, it's your hydration, it's your diet, it's your exercise, it's your health integrity. When you take care of your health overall, which, we kind of learn as we get older for most of us, but investing in your health as early as possible will pay dividends, especially when it comes to your eye health, your brain health, your cardiovascular health, your blood sugar. So paying attention and prioritizing health and listening to your body when it gives you a signal or a symptom that something's wrong, and not ignoring it and not trying to solve the problem with a pill. You got a headache? Great. You want to take an Advil or an aspirin or Tylenol? That's fine. But understand and correct why you got the headache in the first place.
True, true, true. That is, yeah, thank you for that insight too. Also, working so closely with people afraid of losing their sight sometimes. I'm sorry for jumping all over to this, but I felt like, asking this is actually really essential because a lot of people they lose they're very afraid to lose their sight, and everybody will be, because what else can you do about it? So, what has it taught you about life itself, and what has you it? How has it given you a perspective of life? Because vision, you talk about it so passionately. You literally feel it, and a whole different perspective of everybody's individual life and how it depends on it. So, yes, what is your perspective on it, or what is your take on it?
Well, I could spend a lot of time, but also on this. So we are visual creatures. Not all, if anybody who has dogs, they know they operate by their sniffer. They have a high sense of hearing and smell. So different animals have heightened sensory awareness. As humans, our dominant sensory input is visual, right? So that means when we can't hear, that's like a dog that can't smell, a dolphin that loses its ability to use sonar. It puts you into a sympathetic stress response where you pretty much start to freak out, and it's not conscious all the time. The brain perceives, because the way we're designed, that if I can't see, I'm going to die. Whether or not that is logical or rational or irrational doesn't matter. The way we're wired, because without vision, thousands of years ago, you wander into a village, you don't know if they're friendly or unfriendly. When you're hunting and gathering, when you're picking berries, you need to look and see what they look like, smell them before you eat them. So vision was vital for living. Saber-toothed tiger comes in, you get, there's some threat in your environment that's going to trigger fight or flight. So if the vision's not there, we're kind of in this hyper vigilant state. Not everybody, but a lot of people are in this constant state of stress because their brain can't take the information in to keep them safe. So a lot of people start to get this anxiety. They start to get this lack of comfort. They're internally, they just feel unsettled and they don't know why. And conventional medicine doesn't really have a good understanding of that, nor does modern psychology. It's like, oh, you're stressed out about your vision. Go for some therapy, take some anti-anxiety medication or something like that, without understanding and help people to realize that, maybe while 1,000 years ago, you may have died or not been able to exist just because there were so many risk factors and traumas that would take you out as a human. But now we know certainly it's very easy to survive with visual deficits. But our primal brains, that part of our brain, just won't have it. It's like you have to convince it. So it does take some time to convince the brain that you're going to be okay. And this is why creating support for people is so important. And a large part of what we do is building community, because people I've learned who are dealing with these acute or degenerative vision loss conditions, there's one thing in common. They all feel alone. They feel isolated. They feel disconnected because the lights have gone out, partially or fully. Where you can't see somebody's face, you're out of the loop. You can't see expressions. You can't respond. Somebody goes to reach their hand out to shake your hand or whatever, you don't see it. So it impacts your social capacity. You become more self-aware, not in a good way, more insecure. People stay home a lot more. So it really can impact people's psyche, spiritual connection. A lot of people think they're cursed. A lot of people believe God or gods or they did something that deserved this. And I have to have this conversation regularly with patients. There's nothing that they did to deserve this. They're not cursed, but they have a condition. Something happened. And although it's not their fault that this happened, it is their responsibility to manage it and help take care of it if they want.
I get it. And yeah, it is something that they also can't help. And instead of sometimes making them also feel like that, it's better to be their color and their hope in despair, right?
100%. And conventional medicine does not help that. Every week I have patients come in freaking out. It's worse than a cancer diagnosis. Without any filter, doctors, some good, some bad, but not good, bad. It's inappropriate language. I'll say that. We'll just tell patients you're going to be blind in 2 years. Like, how do you know that? And how can you tell somebody that? It's like, just don't say that or say, I don't know. And they'll follow it up with, don't try anything. There's nothing that I can do for you. There's nothing anybody could do for you. So give up hope. And we're going to send you to low vision where you're going to learn how to use a cane. And maybe some point you'll get, a seeing eye dog or something like that. So as you mentioned earlier, they are stripped of hope and devastated. And there are some people who are okay with that. They'll kind of be there. But who we're looking to help or we're here to help are those people who are not okay with that. They're not okay being told there's nothing that can be done. There's no help and there are no solutions. Being sold this bill of doom and gloom that sometimes that we can't help everybody. And unfortunately, that's the truth. But there's a lot of people out there who want help and are being told there's nothing that's out there that can help them. Those are the people we're here for.
Yes, so true, so true. Also, the thing that you said that you do not directly say to them, there are ways that, put it in front of them. And yes, that is also a part of treatment and therapy that you are sensible about what you speak to people when they are going through something like this. So thank you for putting it forward.
Words have
Also,
power, right?
hmm,
Words have power. When you say something, you have a patient in front of you and you're in an authoritative position, like they're going to believe you. So you have to be careful what you say to people. It's like a curse, it's like a magic spell sometimes.
so true, so true. I totally agree with that. Also, Dr. Andy Rosenfarb, listeners, he shows us that caring for our eyes is about much more than clear vision. And all we've talked about today is just that. And, it's about tuning into our bodies, our habits, even our beliefs about what health really means. I totally resonate with it, and I hope you do too. Also, if this conversation it made you rethink how you treat your own eyes, maybe start small, give them a break from screens, add that extra veggie to your plate, or just notice what they're telling you when you're tired or stressed. Because when we care for our eyes holistically, we're really learning to care for our whole selves. This is Pragya Malviya, and you've been listening to Soul Sparks. Until next time, keep seeing not just the world around you, but the life within you.